Hello everybody, my name is Michael Lin, and today I will be giving you an overview of the influenza virus, or what most of us just call the flu. The flu infects between 3 and 10% of the American population every year. It's responsible for over 500,000 hospitalizations and up to 50,000 deaths every year just in the United States. Since the flu was one of the most common reasons I would see children admitted to the emergency department in St. Louis, I thought it would be really valuable to take a deeper look at how the flu works in our bodies, what the best way to treat the flu is, and how to prevent catching the flu every year. Let's start by talking about the history of the influenza virus. Now, since the flu is such a common sickness and since our medical records from before just a few centuries ago aren't very thorough, it's impossible to tell when or where the first flu virus originated. However, thanks to descriptions of pandemics in ancient Greece, historians agree that the flu virus has been around for at least a few thousand years. The first pandemic that historians are certain was caused by the influenza virus occurred in 1580, when a strand of the virus spread from Asia through Africa and up to southern Europe during the Renaissance. After the infamous Spanish flu outbreak in the early 20th century, many researchers dedicated themselves towards studying the virus in order to prevent a similar pandemic from ever happening again. In 1933, they successfully isolated the virus from a human host for the first time, and about 10 years later, during World War II, the United States military successfully developed the first flu vaccine, or flu shot, which was very rudimentary and nowhere near as effective as the flu vaccines we have today. It's important to note that the influenza virus isn't just one virus, but actually a family of them. There's influenza A, B, C, and even D. Influenza A and B are the most common to infect humans, and they're also the most dangerous. Influenza C only rarely infects humans, and it only causes minor sickness, and influenza D can only infect cattle. Of influenza A and B, A is regarded as being more dangerous because it can be transmitted from humans to animals and then back to humans, whereas influenza B can only be transmitted between humans. So most of this presentation will be just focused on influenza A. Now let's take a look at the structure of the influenza A virus on the right of the screen. You'll notice that it's an enveloped virus, meaning that there's a membrane that surrounds coils of RNA at the center. There are two types of glycoproteins that are integrated into the membrane, hemagglutinin and neuraminidase. These are the antigens of the influenza A virus, meaning they are what elicit a response in your body. Hemagglutinin causes your red blood cells to clump together, and neuraminidase is important for the replication of the virus in your body. There's 18 different types of hemagglutinin, and there's 11 different types of neuraminidase, meaning that with some quick math and multiplication, there's 198 different possibilities of combinations for the influenza A virus. However, in nature, scientists have only ever discovered 131 of these combinations to be naturally occurring. So, to name a subtype of the influenza A virus, you just name the type of H and then the subtype of N. So that's where the name for the swine flu comes from, H1N1, or the name for the avian flu comes from, which is H5N1. One of the burning questions I had when I started researching the flu was, how is the same virus responsible for just a small outbreak some years and other years causes a global pandemic that kills millions of people, such as the Spanish flu or the swine flu? And this question can be answered by understanding the difference between antigenic drift and antigenic shift. So, antigenic drift is the reason you have to get a flu shot every year instead of just once in your life, like you do for so many other diseases. It's just very minor mutations in hemagglutinin and neuraminidase, those glycoproteins that are in the membrane of the virus. It's not a change from H1 to H3 or N2 to N1. It's just a very small change in the protein structure that renders the antibodies that your body has saved up from previous years useless against the new virus. On the other hand, antigenic shift is what is responsible for these global pandemics. Shift is the combination of two subtypes, such as H1N1 and H3N2, to form a brand new subtype, such as H1N2 or H3N1, which can be incredibly dangerous to humans because our bodies have no prior exposure to them, so we have no antibodies that can help us fight the disease. These antigenic shifts are very, very rare because they require such an extraordinary sequence of events to occur in a living host. So that's why these pandemics only occur every 10 to 50 years. Now, let's take a look at the influenza virus from a more medical point of view. So, once you catch the virus, it's very likely that you'll have a very sudden onset of symptoms. This is the hallmark trait of catching the flu. With other respiratory diseases, you'll likely have a gradual onset of symptoms, such as a sore throat for a couple of days, and then maybe a cough, and then a couple days later, a runny nose. With the flu, you'll probably wake up one morning and be feeling all of these symptoms at once. And the most common symptoms are a fever, a headache, fatigue, myalgia, and a cough and a sore throat. These symptoms may differ depending on what strain of the virus you caught, because remember, this is not just one virus, but rather a family of viruses. So there's influenza A and B, which are the most common, and there's several subtypes of each of them. In light of recent events, I thought it would be worth taking just a minute to compare the symptoms caused by infection from the influenza A virus, which we've been talking about, to those caused by the novel coronavirus, which is responsible for the COVID-19 pandemic. As I mentioned on the previous slide, infection from the influenza A virus is usually accompanied by the sudden onset of body aches, headaches, and a loss of appetite, whereas with COVID-19, the most important symptoms to pay attention to are shortness of breath and other respiratory issues, because those symptoms are very unique to that particular virus. Since testing for the flu is so common in medical settings, it's fortunate that the test is very easy and quick to administer. The whole test requires less than an hour, and it's just a quick reverse transcriptase polymerase chain reaction, or RT-PCR. This reaction is very similar to the PCR reactions we've studied before, and it requires only a small swab from the nose or the back of the throat to start. If the flu virus is present, its RNA will be reverse transcripted into DNA, which will then be amplified into millions of copies, which are easily detected. This test has 90 to 95% sensitivity, meaning that it is very highly accurate in giving the correct result. However, some professionals argue that testing for the flu is not always required, especially in areas where there's community spread of the virus. One research study found that, quote, the acute onset of cough and fever can have a positive predictive value as high as 85%, unquote. So, oftentimes, no test is necessary if the patient shows all the obvious signs of the flu. And in addition, if a patient is at risk for complications, it's oftentimes smart just to skip the test to start antiviral medications immediately. To reduce the length and intensity of flu symptoms, antiviral medication should be started within 2 days of the onset of symptoms. It's important to note that the decision to treat symptoms does not require a positive flu test. This is because oftentimes a physician may contraindicate a flu test if all of the symptoms are present in a patient, or if the patient is at risk for developing complications and needs to start antiviral medication as soon as possible. Also, very rarely, a flu test may give a false negative result. The antiviral medications that are available to treat the flu are all neuraminidase inhibitors. Remember that neuraminidase is one of the glycoproteins present in the membrane of the virus, which is essential for the replication of the virus within your body. The most commonly prescribed medication is oseltamivir, which is under the common name of Tamiflu. This is an oral medication, which is safe for any age group and can be taken for 5 days. Other antiviral medications, such as zanamivir, peramivir, and baloxavir, have also been shown to be effective against the flu virus, but special considerations must be made for these, especially when treating pregnant women, young children, or people with compromised immune systems. And as with any other sickness, proper rest and proper hydration are essential to a speedy recovery from the flu. Transmission of the flu occurs through respiratory droplets, such as those released through a cough or a sneeze. Then, if transmission occurred, about 1 to 4 days after the exposure, there will be an abrupt onset of symptoms, like I mentioned earlier. From the time symptoms begin, they're expected to last between 1 and 2 weeks, with the patient being most contagious from 1 day before their symptoms begin to about 7 days after their symptoms begin. The mortality rate depends on the specific strand of flu that one is infected with the mortality rates ranging from 0.1% for the seasonal flu all the way up to the outrageously high 60% for the avian influenza A. Unfortunately, complications while sick with the flu are not uncommon. These complications can lead to more intense symptoms, respiratory issues, and sometimes even death. The populations most at risk include those younger than 2 and those older than 65, those with asthma, pregnant women, and those with underlying medical conditions or compromised immune systems. For these populations, antiviral medication is highly recommended despite the possibility of it inducing nausea. The most common complications to arise are viral or bacterial pneumonia, which are also among the most dangerous. These could require the patient to be transferred to an ICU and placed on a ventilator until the pneumonia subsides. Luckily, preventing yourself from catching the flu is a very straightforward task. The CDC recommends that all people above the age of 6 months receive a flu shot once per year in October. The flu shot is between 90 and 100% effective in preventing the flu. The only population who is advised to take special caution when receiving a flu shot is those with an egg allergy, and they're advised to receive their flu shot in the presence of an allergist or other physician in case an allergic reaction occurs. In addition to receiving your flu shot, it's always advised to wash your hands, of course, before and after eating or using the restroom, to avoid touching your face, and to disinfect communal surfaces where the virus might be living. It's highly unlikely that we'll ever completely eradicate the flu virus because of its rapid mutation rate and because of its ability to survive in animal hosts in addition to human hosts. However, the National Institute of Allergy and Infectious Diseases is currently working on a universal flu vaccine, which would last several years rather than just one and would replace the annual flu shots. To get a better idea of how this universal flu vaccine would work, let's first take a look at how our current annual flu shots work. On the left side of this slide, you'll see that we have our annual flu shot, and on the right side, you'll see we've returned to our image of the influenza virus with our hemagglutinin and neuraminidase glycoproteins, which are integrated into the plasma membrane, which surrounds the RNA coils at the center of the virus. So the vaccines that are currently in use contain deactivated viral molecules with glycoproteins very similar to the hemagglutinin on the flu virus. And these viral molecules stimulate the production of hemagglutinin antibodies within our immune system, which are then effective against the flu virus later in the flu season. However, because hemagglutinin is a very rapidly mutating glycoprotein, the antibodies we produce against it are only effective for a few months, and by the next flu season, they're ineffective against the newly mutated virus. However, neuraminidase is a much slower mutating glycoprotein, so researchers are currently working on producing a vaccine which will stimulate the production of antibodies to neuraminidase instead of hemagglutinin, and these antibodies would hopefully be effective for several years rather than just for one flu season. These new vaccines are currently in testing, and hopefully they'll be out and available for the public very soon. Thank you all so much for your attention. I really hope you guys enjoyed learning about this as much as I did, and I greatly appreciate all of your feedback and all of your comments.